Thanks, David. Thank you all, and I want to also thank the organizers for the invitation and the ability to talk about digital health and sickle cell disease. What I thought today would be a great opportunity is to show you a little bit of the work that I've been doing, which I think has really evolved. I mean, we all know that digital health has changed over time, and I was actually really excited to see the previous presentation as well, because as you can see, sickle cell disease is so complex that we really need to think very holistically about the patient. And so today I thought, if I could just give you a little bit of a teaser of all the things that are going on to really stimulate your ideas and think about, what can I also be involved with? What else should I be thinking about in regards to digital health and sickle cell disease? And I think I focus on pain. I absolutely am so happy that it was brought up that quality of life is actually really the big topic. I think pain leads to a lot of quality of life issues within sickle cell disease. We really do focus on pain, but I wanted to highlight pain because we always use this iceberg because it's the tip of everything, right? So quality of life and everything that goes along with the issues that patients with sickle cell may have is really just the tip. And I'm going to show you one slide just to say to introduce the Pisces study. This was a study done by Wally Smith several years back, and he followed a couple hundred patients. And what he did was he just gave them a diary, a paper diary, and said, just complete this, and let's see where we go. Let's see how much pain you have. Let's see how much, it was an SF-36, so it was a quality of life. How are you doing over time? And he did have a great completion rate. It was 85%. But to do that, he had to call the patients frequently. He had to give them a stamped envelope, and he actually had to pay the patients to make sure that they got that information. And if you look at the data, because I think this is actually something that we refer to quite a bit, you can see that the amount of patients, and this is in the United States, but in the United States, that 3.5% of the patients actually had pain that actually went to the emergency room. So all this acute care utilization where they went to the hospital, the ER, was really a small percentage. And the vast majority of patients with pain did not go to the hospital. They're trying to manage pain at home. They don't want to go to the hospital. But the other thing I want you to also kind of maybe pick up on is that the difference between these categories is very small. 5.9 versus 5 versus 3.9. So almost just a 1 point difference on the visual analog scale. Another follow-up study, before I kind of dive into why digital health I think is the future, is a pediatric study where they gave pediatric patients a daily pain log, and they got lots of data out of this. Their completion rate, they said, was 90%, but they didn't verify contemporaneous completion. Contemporaneous completion is what we also call parking lot completion, where a lot of times patients, they just want to have the data and then they just quickly fill it all in at the same time. And there was a follow-up study that showed that if you actually used electronic diary that recorded every time they opened the diary, not actually just what was filled in, it looks like it's 90%, but the actual opening of that electronic diary was actually 11%, right? So they're only opening 11% of the time as they're supposed to. So let's dive into, pain, I think, is clearly occurring more than what was previously realized. It's not ideally monitored by a paper pain log study, and pain leads to high utilization. So what can I do to kind of intervene here? And I think this is where I introduce, where I had the first realization. This is now maybe 7, 8 years ago now, that digital health is here. And that's because I walked into my patient's room, and this is what I see. So I walk into my patient's room and I see the mom on her device. I saw the 2-year-old sibling on the floor scooting around with his little iPad, and the patient himself also on the exam room table, but with a device. And so really trying to peel them away from this digital device so that they can listen to me, interact with me, and talk. And so that's when I came to this thought that I need to be involved. I need to find out a different way to communicate with my patient so they understand and want to interact with me as well as a medical provider. So, so from a patient standpoint, I think that one thing that we consider to engage with them, I could text them and I could tell you straight up, a lot of patients will say, Dr. Shah, if you call me, I'm not going to answer. None of my patients answer phones anymore. If my clinic calls them, they're not going to answer. But if you text them, and especially if you text them with an emoji of some sort, they're going to respond. You need to kind of get to the point where you can get them to feel like they're engaged with you, and texting is one way. But myself and my research nurse started making mobile apps, and so we started making mobile apps to monitor symptoms, monitor medication compliance, and get them to record how they're doing with that. Education, we can go ahead and just put all this education that we're trying to give them in clinic, give them videos or educational blogs, access to information, and also the ability to communicate with the medical team. And that may not be me myself, but it may be my transition coordinator. I'm the director of the transition program, so I see both kids and adults. So if I could get them to just talk to my transition coordinator, that would be wonderful. But we're now, in the last couple of years, getting even more sophisticated. Now there's the ability for chat bots. So there's these little robots that you can actually talk to that engage with patients. So it's almost like you're texting someone, but it's a chat bot. You can gamify these apps to get it so that the kids are excited about what they're doing. And finally, there's all these wearable devices. So there's the Apple Watch that you have, the Fitbit. There's all kinds of wearable devices that passively get information. Now, the digital era doesn't forget the providers, the medical teams. We need to remember we're also part of this. And so can we have if the patient's recording symptoms, I want a symptom dashboard. I want to see how my patients are doing. I want to see how their medications are being taken. I want to provide the education to the patient through the app. And finally, I want to see that communication. I want to be able to make sure that I'm getting the information to the right person, from patient to provider and provider back to patient. So I'm going to give you a little bit of examples for each of these in a different way throughout the presentation. And then hopefully, again, you can see where we're going with this. And finally, of course, if we're having wearable data, and this is kind of a nebulous thing right now, there's a lot of data you get from your wearables, surprisingly. And so do I want that information as a provider so that I can say, oh, it looks like my patient's not really walking anymore. He seems to be not sleeping very well. What can I do with that information? So that this last part that I'm highlighting because it's actually really taken off in the last 2 to 3 years, and shows you that we're really accelerating in the amount of information we're getting from patients now. So example one, remember, patients for the most part are not in my office. The patients are living their lives in school and working and doing everything outside of my office. So how can I get a piece of that information to me? So we built this is one of our first apps where we just wanted to see, can I record symptoms? Can I text them remotely and follow up after an acute care visit? So I can monitor their pain, some of their symptoms. And what I first started with is what we call the day hospital here at our institution. A day hospital is a mini emergency room. So they don't go to the main emergency room. They go to a sickle cell mini emergency room, which is staffed by us. But even with that, which is a great use of care for patients, patients don't have to wait in the emergency room. There's still a lot of reutilization of care. Patients come to our day hospital, but 60% of the time, they'll come back into the healthcare system in some way. They'll either come back to the ER, they'll come back to the day hospital, or they'll maybe even be admitted. But we're hoping to try and use that day hospital so that they don't get admitted and they don't have to go to the ER. But that showed that if 60% are coming back, these patients that are having a lot of problems with pain and trying to manage how they're doing. So can I do something better? So we randomize patients to either get standard of care, which is to treat them and have them go home, or get my smart app, which was the name of our app. And the smart app, as I said, would allow them to monitor their symptoms, I could see how they're doing. I could text them to check in on them and see if I can make a difference. So this is the dashboard. I could look at my app and say, oh, this patient looks like their pain goes up and down over time. And so this is an actual patient you can see over the weeks here. And you can see that the average pain for this patient is usually 3.5, but on average at the very bottom, you can see the average is 5.4. So they're clearly living above their baseline. So, this was a patient that did come into the day hospital. I provided the app and I wanted to just check in on them to see if I can improve how they did. So we enrolled 20 patients. It was an adult study. We gave them the app and we saw that they came in less often. Patients' standard of care came in 70% of the time. In patients in the mobile app, at 12-day follow-up and 30-day follow-up, they came in at 30 and 40%. So we reduced the amount of patients coming back to the hospital. And reutilization of care, you can see again, is 50% and 20% for those patients in the mobile app. So not only are patients coming back to the office like they're supposed to, but they're not coming into the hospital and being admitted. So we're looks like we're trying to make a difference with this hospital. Now, how is that happening? Part of it is because I'm texting the patients and I'm monitoring them. So I would text them at least twice in that 30-day period. And I would text them simple things like, looks like your pain is getting a little bit higher. The weather's probably not helping, but let me know if I can help. And you get a response very quickly. Yes, it looks like the rain is not helping. But I'm feeling a lot better today. So it was good to kind of have this interaction where I normally wouldn't between clinic visits. And 60% of the patients returned their text. And it was interesting that 2 of the patients, who didn't return their text, both came back as well. So that, it is interesting to see that the utilization might be a key way to get a hold of patients. So another example is a compliance app. So we know that patients, just like any of us, don't love taking medications. We have to remember to take our medications. And especially with iron chelation, I noted several years ago that if you had to mix a powder in and had to take that drink and drink it every single day, it could be a little bit annoying. And so how could I get my kids in my clinic to be excited about taking this? And so we developed this intensive training program app. We would educate them, tell them to take a video selfie, so I could actually see them taking their medications. And then I would send them a video back. Well, myself, meaning my team, I definitely didn't want to send them a video of myself every time, but my team, my fellow, my nurse, to motivate them to say, oh, you know what, you're doing a great job, keep up the good work, and we love to see you keep this up. And so it was a very simple app. We just had them take video selfies. They could record this educational lesson in clinic so that when we educated them, they could refer back to it when they wanted to. And it was just a pilot study, 11 patients, 9 with sickle cell, 2 with beta thal major, all were on chronic transfusions and on a stable dose of chelation. I'm showing you the demographics just to highlight one thing, and that is that the vast majority of patients, 71% of the patients were taking were not being compliant. They're not taking their medications and they're missing at least 2 or more doses per week. So definitely had room to improve here. So what we saw was that our patients love taking little video selfies. They actually, they would send me a video every single day, and you'd see the median was 100%. The average was 81%, 82% at 6 months. So at 6 months out, our kids are recording these videos every single day, 82% of the time. That's pretty amazing that kids were excited. Now, we did pick up on a couple things. The first is that males, so the boys in my study, they were very brief, 12-second videos. But the girls, they would flip their hair, they would send me little messages, they had lots to say. Surprise here, right? So the girls were very interactive in telling me how they're doing, how their day went at school, but they recorded their videos. And so we had a range of these selfies, but just excited to see that they were starting to be interested in being compliant and sending me that message that they're taking their medications. Now, there are a lot of other things that were nice to see in this, in this digital type of communication. they would send me messages directly, like, Dr. Shah, make sure you remind me, I got to talk to you about this. They would sometimes tell me about the taste. I could see how the parents and the child were interacting around the medications. So all these things that then were good discussion points for when they came into clinic. Now, there are tons of apps out there. This is just a snapshot. If you I just searched sickle cell on the App Store, in the Apple App Store, and these were just some of the few that came up. And honestly, I know of all of these. The two on the right, In Charge and True SCD, those are actually apps that I'm a part of. So I mean, there's a lot out there, and I just want to show you that there's a lot for us to consider. But the next thing that I wanted to kind of dive into is, um, I think we're coming a long way. And so the next thing I thought about was, what is this? What do we do every morning? We come up with a routine, right? So we get up, we eat our breakfast, we get dressed, and we go brush our teeth. But I'm showing this phone for a reason, because how do we do that? Because yeah, we have an app, but I would be surprised if not many of us pick up our phone. We also pick up our phone in the morning. That's part of our routine. And when we pick up our phone, we're trying, why do we do that? We do it to get prepared, right? We want to get prepared for the day. So we may check our email, we may check our text, maybe check Instagram or Facebook, whatever it is, to see what's going on, to get prepared for the day. But the other thing you do is you check the weather, right? You check the weather, because especially if you have sickle cell, my patients check the weather, because if it's cold, it's going to be 32 degrees, really, really cold, or if it's going to be rainy, you got to be prepared for that, not just with an umbrella, but do I need extra medications? Do I need to really bundle up because I need to make sure my temperature is modulated? And this got me thinking, if I can prepare for the weather and prepare for like rain, well, why would I not be able to hopefully prepare for something like how you're doing, like prepare for pain? And so my thought is, and I'm really trying to work on this, and I'll show you some of my work on this. Can I predict pain? And this is based on an individual's history of pain, the symptoms they're having, how much medication they're using, the wearable data. As I said, you actually get a lot of data out of wearables. And the goal is to help patients better prepare. So not just prepare for the day from a work standpoint or a school standpoint, but can I prepare, for how I'm going to be with a patient with sickle cell in regards to pain and my quality of life and everything else I need to do. And so that was my next push in everything that I've been doing with research. And this is just a fancy way to show, there are zones, and pain goes up and you get to this red zone, and there's a lot of data that we can monitor, that if we put together, we can forecast how we're going to do. When we predict pain, it's not just in the now, but what's going to happen a couple hours out, just like the rain prediction. And we can sometimes get mad at the weatherman, right? But it's just a prediction. Is there an 80% chance for pain? Is there an 80% that I need to be prepared for? And the reason I can do that is because I get a lot of data. There's a lot of data out there. We can get heart rate, GSR is the galvanic skin response, how stressed you are, how much steps, skin temperature. There's a ton here, how much you're moving, all from a wearable. So I'm going to, again, just give you two examples here. We did this with our day hospital study again, as well as outpatients. And the first step is, here's an app, go home with it. Just tell me how you're feeling, how much medications you're taking, and we'll go through this. So I got 39 patients, 3 institutions, Duke, Pittsburgh, and Vanderbilt, which is in Nashville. So very different temperatures. Pittsburgh's very cold. It snows a lot in Pittsburgh. And I'm in North Carolina. It doesn't snow a lot here. And what you see is that the pain scores, the green line is Pittsburgh. You can see that in the morning and at night, the pain is highest. And then it kind of steadies out in the middle of the day as it gets warm. So you can start to see that temperature has something to do with this. And there are differences based on location. But you can also build heat maps. And so you can see that red dot there around 9 p.m. is when most patients are recording the worst pain. So you can start to figure out Well, there are times a day, not just locations of where they live, but times a day that are also an issue to patients. And that's important because maybe I need to warn a patient that this is part of, the times that you start to have issues. And then we layer in medication. So this was a study that we published that, when patients take medications, we expect the pain to come down. When patients take even an NSAID, ibuprofen, or something anti-inflammatory that's not an opioid, the pain should come down, but not as much. And we modeled this through all those patients that were outpatient, and it actually does track into that little red arrows, the red lines. So we are actually predicting a little bit of how they're doing. But now let's get more specific, because I'm getting into the home stretch of my time here. I want to make sure I get through what I have. The second example is, so I'm going to give a wearable. This was the Microsoft Band 2. We don't use this very much anymore. But again, same app, but I just want to put this on patients in the day hospital. Day hospital, again, our mini emergency room. When patients are not feeling well, I give them fluids, I give them IV pain medications, and now I put a wearable on their wrist, and I record how they're feeling with this app with pain scores. And I wanted to see, can I predict their pain? Can I, they're recording their pain on a 0 to 10. And we got, again, another pilot study, 20 patients. They're recorded for about 4 to 6 hours. That's usually how often they're in the day hospital. And we use different machine learning techniques. Now, machine learning, we have these very smart statistical math people who can use these computers, and the computers basically let the data do the talking. So instead of us trying to do simple correlation, does heart rate correlate with pain? Now there's all this data. I showed you all the data I can get from a wearable, but can I use all that data to predict the pain scores? And we did. And we actually were able to predict with 70% accuracy. We're very accurate to predict the pain score at any given moment. So that's in the now, based on your wearable data. So just wearing this wearable watch, all the information that comes out of there, I could say, looking at this data, 70% accuracy that your pain is a 7 or an 8 or a 9. And you could see we were pretty accurate based on this little chart here. So again, promising. I have more room to go. And this is to the exact pain level, which is pretty interesting that I could get that specific. So, it gave me some excitement and said, okay, well, let's keep running with this. But what else are we using digital health for? Well, I mentioned, a lot of us also are wanting to make sure that medical providers have the information they need too. So myself, I regard myself as a sickle cell specialist. I do care primarily for patients with sickle cell, but there are a lot of providers that don't have that expertise, and I want them to have that expertise. So I made another app. We made another app that provides education. It's called the HU Toolbox. It gives algorithm. It's SCD Toolbox or HU Toolbox. There's two different toolboxes. They're pretty much the same, but it gives you algorithms for different situations. So for the SCD Toolbox, if you're on transfusions, what are the standard of care things to consider? If you have shortness of breath, what should you consider? But it also allows you to communicate with the specialist. And then these complicated algorithms, which we got a bunch of smart people in the room. We got pediatricians, sickle cell specialists, nurses, patients, all in a room. And it's like, what are the algorithms to help a provider who sees a patient who, let's say, for example, on hydroxyurea? How do we get them to digest this algorithm? It's pretty complicated. Well, again, I got these chatbots. It's actually, once you know the algorithm, I just ask, is your patient on a hydroxyurea? Yes. Is your patient missing doses? Yes. Are they consistently taking it? Yes. Have they been on this stable dose? Yes. And then you walk them through, what are the labs? Do I need to consider changing the dose? So these chatbots are actually not that complicated now. Once you come up with the algorithm, which we all are very familiar with, we give algorithms to the emergency room, to primary care doctors. This is how we think about things in medicine, but now it's a more user-friendly way to walk through a decision. And I wanted to show you another way. This is not just for medical providers, be it practitioners, nurse practitioners, physicians assistants, physicians, and nurses, but the whole team should have access to digital health. And so we built an app for the transition program. Now, again, because I see both kids and adults, it's very near and dear to my heart to try and get information to my young adult and adolescents. And so I wanted to give them education and communication with the transition coordinator. So this is the Step Up app. We have a study that uses this, but basically you can see that we have at the bottom left here, the tabs. There are websites they can go to. There's a library of information. This is for another talk another day, but the who, what, where is just how I educate patients, who they are with the disease, what does it mean to have sickle cell, and what are the complications, and where are they going in life, right? We want them to be successful. We want them to go to school and graduate and have a job. So all these things, the who, what, where is just is one of my ways of doing that. And then finally, the communication. So we can text the transition coordinator. So finally, I want to just show you where we're going. We're starting to adapt, right? Just like I think apps are developing, wearables are developing. The last app I show you is digital health for kids. We have to recognize that kids are probably the most digital savvy. They're the ones that are teaching us how to use devices, right? And so we made an app for kids based on what they told us. They wanted it to be more fun. All the previous apps you saw were definitely more adult-centric, and this was one that had more interactive pictures and emojis, and you could see they actually wanted emojis to how to record how they're feeling. So how happy they are and angry they are, those are emojis now because the kids, they were excited about that. And then finally, we started to gamify it. So there are badges. So if you visit certain pages or see certain lessons or educational modules, you get badges. And so that, there are hundreds of badges you can get. And a lot of times kids will come in and say, Dr. Shah, I got this one specific badge I've been waiting for. So again, I think we need to understand that we need to adapt and change over time. So this is the future here, right? And again, I think it was very appropriate in the previous presentation to put the patient at the center. But what I'm talking about today is surrounding them with things that I think are digital. So we have our doctor, we have ways of digitally communicating with the patient now with medical records and possibly apps. We have analysis of this information in the background. We have the healthcare system communicating with the patient, and now these sensors, and the sensors being the wearables that can passively give you this information over time. So I'm just, again, thankful for you guys to just hear a snippet of what I'm doing. I know it was a whirlwind of information of all kinds of things, but I really just wanted to give you a teaser of what digital health can do and is doing for sickle cell disease. I hope that each of you can take away ideas where this might be helpful for your patients, and you could consider what this may mean for you moving forward. So thank you very much for your invitation to speak today. There's of course a lot of people. Jude Jonathan, of course, is my research nurse who builds these apps, and I have to be thankful. But all the way down, many teams, many patients, and I want to make one quick shout out to the many students. I absolutely believe the next generation are the students in college and high school and graduate students who are, again, more tech savvy and are going to be able to carry this forward. So thank you again. I appreciate the time and love to answer any questions when the time comes. Thank you.